Hi, Tavius here. Just wanted to take a few today to talk about something that I think is important for a lot of people. Now, before I'm done, the information that I give could actually save immense injury or even fatalities to yourself or people you love, and definitely you want to listen all the way through. Now, in addition, if you are having issues that may be resulting in tight finances because of your situation, then again, there's some information here that I think will help you greatly. But you'll need to actually sit all the way through here to be able to get all that information. Now, the first thing I want to talk about is seizures. Now, a lot of people have different issues. You may have epilepsy, or you may know somebody that does. Now, as a person who actually has it, I just wanted to share a little bit today about what to do if somebody you're with starts seizing. Now, if you're the person who has these and you don't know what to do, you can kind of follow some of the same advice. But the first thing is, let me go ahead and describe for you what the seizure is. Now, generally, this is something prefaced by what's called an aura, where for me, I hear sound, sometimes get kind of a strange smell, and I just know that something's about to happen. If that's the case, I tend to get myself where I'm going to be kind of safe generally. You have two kinds of seizures. There's petit mal, and then there's the grand mal. The petit mal is also known as the absence seizure. It's where you are just gone. All of a sudden, you have no idea where you're at. And it might take a couple minutes, and then you come back and you might forget everything for the last week. This has been my most common kind of seizure. But you also have the grand mal, which are the ones where you start thrashing and can actually hurt somebody if they're too close, or if you're too close to something, you can actually hurt yourself. Now, what do you do whenever one of these seizures comes on? Now, one of the first things is to cushion that person's head, especially if we're talking the grand mal seizure. The petit mal or the absence seizure is just one of those things that a person just kind of sits there like that. And whenever they come back, there's no big deal. But just trying to get your memories back, which happens. But whenever you're dealing with the grand mal type seizure, that's where you start thrashing. And there you want to go ahead, cushion the person's head. If you have a pillow, put it there. If they have glasses, take them off. Loosen any kind of tight clothing. If they're wearing a tie or something like that, loosen it so they're not going to choke themselves. If you can, turn them on their side. Sometimes it might happen on the floor or on a bed. And if you turn them on their side, if they end up getting sick, they're not going to choke on vomit or something like this, which can happen. Do not put anything in their mouth. There's a big rumor running around that, if a person's having a seizure, you need to put a wallet or something in their mouth so they don't bite their tongue. But actually, that can cause even worse damage, because what can happen is they can break teeth, they can bite so hard they end up breaking their jaw, things like this. So do not put anything in that mouth. In addition, if this is somebody you don't know, or even if it's somebody you do, you can look for ID, see if they have like an ID bracelet, or if they have a necklace, something like that talks about medical issues. You can look for it. Do not hold this person down. If they're going to thrash, let them do it. Holding them down, they're just going to pull their muscles, and it hurts a lot more after the fact. I can actually attest. After these seizures, especially grand mal, aches can be there for weeks at a time sometimes, and you don't want to do any more than you have to in trying to restrain them. You don't want to restrain them because they can hurt themselves even worse. Now, as the seizure ends, then you can offer help to the person who's having it. But there are a few specific instances I want to go ahead and talk about where you really need to make sure you call 911. Now, if a seizure lasts for more than 5 minutes, definitely call 911. Also, if that person has a second seizure right after the first, again, this is an issue you need to consider. If they have problems breathing after the seizure, if they don't become conscious after they're done shaking, if they don't have any kind of medical ID, um, and if the seizure has happened in water. These are all situations, and water can actually drown a person. These are all situations that you want to call 911. There's a few more. If the person has diabetes, they're pregnant, have hypoglycemia, head injury, heat exhaustion, they could be poisoned, or high fever, they could also get this kind of seizure. If it's things that are not indicating a regular seizure activity like epilepsy, then you definitely want to go ahead and call 911. And if you're not sure about it, your best bet is go ahead and call 911 anyway, because it can make a difference in this person's life, and you're better safe than sorry. Now, in addition, one other thing that you want to really keep in mind is this person having the seizure is going to be disoriented when they come out of it. So do what you can to help them. If they're, back with it a little bit, you can help go through from there. These are some of your basics of things to look at whenever this person's having a seizure. Now, this can make a huge difference in how things are afterwards. Now, you can have sometimes a series of seizures, where I've actually had this a couple weeks ago, where you get out of a seizure and half an hour later, you might go into another one. And these can be issues, and if you keep having that kind of a seizure activity, I would definitely call and have somebody help you out there with the 911 if necessary, or call their doctor if you have it, if you have a contact direct for them. But those are some things to think about. Now, one of the other things that a lot of people have an issue with, especially when you're dealing with disability like epilepsy or seizures. Now, for myself, mine is entirely caused by brain surgery. This, incidentally, for those who have cell phones, I would recommend not holding your cell phone up to your head that often. I used to work for a cell phone company, got almost unlimited minutes, and almost always had a phone to my ear right there as I was driving. If I'd have one hand up, driving along, one hand holding my phone like that while I drove. Now, a lot of people are starting to develop brain tumors, and this is something that I think can make a difference, is where you keep your cell phone. If you can use a hands-free, like a speakerphone, sometimes there are certain headsets that have like an actual tube that goes up like so you don't have a direct speaker in your ear. You have like a tube that comes up and up to your mouth. In a situation you have to use a headset, that's the best way to go. In addition, the other thing to be aware of is if, for women, do not carry your cell phone in your bra. I actually know a couple of different people who've been through breast cancer, and that was one of the things they had in common, is that was where they kept their cell phone. And if you look at more, I'm sure if you look on the internet, you're going to find lots of instances where people have bras, having their cell phone in their bra may have caused them breast cancer. Make sure to be aware of it. I mean, where you keep that cell phone, if you keep a cell phone even in a pocket, you may end up with issues, rashes, or worse. So when possible, do not keep your cell phone in any place intimate to yourself. um, because it can make a difference. And, I want to try and prevent other people from having the kind of issues I have. I mean, this tumor that developed was right at my speech center, and so they couldn't get all of it. Now, the other thing that I wanted to mention right quick is just a bit of information about what do you do if you have no income left. A lot of people are all of a sudden not having a job, or maybe you do have a job and you just don't have time to do what you want. These are all things that can make a huge difference, and you want to go through as you can to, um, like, as an example for myself, I've been both in a situation of being bankrupt and having to start all over again, having so many bills that I couldn't have paid them. And maybe I had a job that was paying well, and just suddenly it went away. And I actually used to be a salesman, so I had a good income, and then all of a sudden January came around, and all of a sudden my income just cut way down. A lot of times for a lot of people, there are different things that cause you to have a scarcity of cash. Now, one of the things that a lot of people look at is, what do you do to get it back? Now, if you look at the blog that this is posted into, if you find this somewhere else, go to www.whoistavius.com and check it out. But the information here can change your life, because for the cost of a dinner, you could find an additional 1,000 or 10,000 a month coming into your life. And this, if you want to learn how to do that, take a look at the video. You'll actually need to click on the link below, put in your email address, and watch the video. Now, there's another one that just says sign up here. And you can do that if you don't want to watch the video. You just want to go ahead and do something to control your life. Just click it and enter that information. But, take a few, look at the video below, or the video link, and watch the video, or again, just sign straight up. But whenever you're done, it's $25. And who doesn't have $25 to spare somewhere? If nothing else, a lot of people put that much money into going to buy sodas or something like that. If you give up sodas for a month, you'd have the money. So is it worth it to put that extra little bit out now? Maybe you're going to have a little bit of extra work involved to make that kind of money. And I know people who've actually been making over $10,000 or $50,000 a month even. The woman who told me about this in the first place has pulled in over $18,000 in her first 3 months. So, what you can do with it is totally up to you, but the one thing I can guarantee you is you are responsible and capable for your own income and situation. No matter, even if you're disabled like me, you can change your life. So all you have to do is decide to take an action. If you do nothing, I guarantee you're going to be in the same situation another year from now. If you at least take an action, there's a possibility of making a change. There's no guarantees you'd make $10,000 a month, but I know a lot of people who are. And, I am willing to help somebody who's willing to help themselves, but you've got to actually take action. So click the link below, take a look at it, pull out your credit card, pay the $25, and just get started. And, aside from that, hopefully the information I've given has helped out in issues with seizures as well. So, Tavius here, signing off. Keep an eye on my blog at www.whoistavius.com for more info. Thanks. Have a great day.